So made in various countries, but it all depends on the quality of the implant. Some are famous, well known, so it is always good to place them, because when you place them, then wherever you go, if there is any problem with the implant, you always find a suitable part for it later on, which is actually a problem that comes usually after 10 to 15 years, because as we age, there can be some problems that's happening. But by far, it is now the most trending thing to do, and the people are actually asking for it. Usually, the usual pattern to do an implant is after extraction, we wait, if we remove the tooth, and we usually wait for 1.5 to 2 months for good bone to form, place the implants, wait for 3 months, and then we place the superstructure, that is the crown. Now, nowadays, it is trending to replace the implants immediately after removing the tooth. That is, the tooth is removed. If the bone is good, we place the implants, and then we place some grafts if there is space. Grafts means powder, which will help the bone to form, and then we place the implant immediately, and again we wait for 3 months and place the crown. There is also another the trending thing is the immediate implants. That is, you place immediate loading implants. The first one that I said is the immediate implants. That is, when you remove the tooth, you place the implant at the same time.